So essentially, these rods are being injected directly into the tumor microenvironment, distributing through it, and then we're passing a near infrared light through the tumor. The light energy is converted by the gold nanorods to heat. And so that thermal conversion is the essence of really the trigger for immunotherapy.
All right, welcome back inside our proactive newsroom. And joining me now is Dr. Carmen Giacomantonio. He is the Chief Medical Officer for Sona Nanotech. And Doctor, how are you? Good to see you again.
Great, Steve. Good to see you as well.
So
You're
I
having
know
a
you've
nice
had
sunny
some,
day.
yeah, it's a good day today. And I know you've had some recent news out in regards to your gold nanorod trial. And we'll get to the news in just a second, but maybe remind everyone what the company is trying to do here.
Yeah, so what we've done is we've used gold nanorods, which are nano size rods, 60 nanometers by 50 nanometer rods, to essentially generate hyperthermia in the tumor core or the microenvironment. So essentially, these rods are being injected directly into the tumor microenvironment, distributing through it, and then we're passing a near infrared light through the tumor. The light energy is converted by the gold nanorods to heat. And so that thermal conversion is the essence of really the trigger for immunotherapy. And that creates a cell death process called apoptotic cell death. And as those cells die, the immune system that would be responsible for dealing with the dead cells and debris, represent those cells and their components to the immune system. Cancer would have complex and novel antigen, novel protein in its being that would be of interest to the immune system. So the targeted hyperthermia creates the tumor cell death that triggers the immune response.
Okay, so you've got to get to certain stages here, and you most recently announced that you've cleared endotoxin testing. So maybe explain what this is and what this step means.
Yeah, so when you prepare the gold nanorod, Sona prepares the gold here in Nova Scotia, and when the nanorods are prepared and packaged, they have to be tested to make sure that there isn't any contaminant. Now, endotoxin is really it's the part of a bacteria. If you had a bacterial infection, the thing that makes you sick is the toxin in the bacteria. So the body responds that it triggers an aggressive inflammatory and immune response. So if endotoxins are contained within the gold, of course, they wouldn't be safe for use in human trials. And so we've just had our study results back, and they're clear of any endotoxin whatsoever, which makes us ready to move into our next phase of research.
Yeah, and that's the first in human clinical study. So maybe explain how this is going to work, what sort of the timing around it, things like that.
Yeah, so we're very excited about this. Our first in human clinical trial is what's referred to as a feasibility study. This has never been done. So the first study will target 10 patients with melanoma, and so melanoma that's spread to the skin, either on the surface or just beneath the surface. We will be then enrolling those patients. These patients will all have been treated with immunotherapy, standard immunotherapy that the world is well aware of today, and will have not responded. So they'll have either progressed or they'll have not responded with tumor reduction. And so we have a research organization that will select patients for us. Principal investigator will identify the patients. We will inject their tumors as described and then treat them with the targeted hyperthermia. The objective of the study is to demonstrate that it's safe, well tolerated, and feasible. In other words, it can be conducted in a clinical setting. The technique can be learned and administered safely by local staff, and patient selection is appropriate. The objective of the trial is just that. The first trial will be to demonstrate that this is a safe protocol to be administered. The second part, the sub-study, will look at the tumor response. And so we will follow these patients for 28 days. 28 days be a fairly short time, but it's a window on these non-responding tumors to see first bit of information is, was there any reduction in the tumor? Did the tumor change shape, size, larger or smaller, preferably smaller? And then the second part is a biological analysis to show we will biopsy the tumors before we've treated them, and then twice during the course, once in the middle of the treatment and once at the end, if there's residual tumor, to show that we've initiated an inflammatory and an immune response that wasn't previously present in the tumor through the process. the patient will be on another immunotherapy that currently isn't working. They don't have to stop, but they will be enrolled and can receive the treatment concurrently.
And then obviously you'll take data from there and whatever and decide on next steps after that.
Yeah. So that data
Okay.
really is the window to the next phase, which would be a larger pilot study. Once we've demonstrated that it is safe, well tolerated, and ideally has some efficacy in these unresponsive tumors, will really give us that's our runway to the next question.
All right. It's going to be a busy time ahead. I know that. Thanks so much for your time. Really appreciate it. We'll talk soon. Okay.
My pleasure. Thanks for having me again. Good to see you, Steve.
Yeah, good to see you as well. There's Dr. Carmen Giacomantonio. He is the Chief Medical Officer for Sona Nanotech.